How did you get started in the ultrasound field?
Well, that's such a good question because I've actually grown up with ultrasound. I'm so proud of the amount of knowledge that I have because when I started ultrasound and started my career, we really only used ultrasound as a listening device. And we mostly use it strategically for very limited OB ultrasound. So obstetrics. And as the...
Oh, you would listen to the baby's heartbeat with an ultrasound device.
Yes. And we never had the way to look at blood vessels and listen to them with Doppler. We either had to have a handheld Doppler and then look with ultrasound. So now those great engineers, they married the two technologies. So that's called Duplex. And so sometimes the doctor will say, you need a Duplex ultrasound. So that's kind of how that term came about, the two technologies. So when I started ultrasound, I was in pre-med. And
you were pre-med?
I was in pre-med at the University of Washington. And this technology was available. There was lots of other things, too. Everything was growing. But then something really tragic happened to me. I think I told you about that. I actually was in college, and my leg started to swell. I was an athlete, and I didn't think too much of it. But then my leg started swelling more, and I recognized that I probably needed to seek some medical advice. So I went to the clinic, and the doctor told me he thought I had a blood clot. I was really frightened, and at that time, and this is giving away, before we even had ultrasound to make the diagnosis, I had to have a venogram.
A venogram.
And that's where they inject dye into the vein, and they use radiographs to determine if you have a blood clot.
So they actually put a needle in your skin and then take a bunch of x-rays, right?
Correct. It was very painful, but mostly it was frightening. And so they told me then I had a blood clot in my leg and that I had to go into the hospital. And I had two small children, and it was just really, really scary. And the most frightening part was that there was really not a good explanation why I developed a blood clot. So it was 5 days in the hospital, and it was really lonely, and it was really a telling time for me to say, what can I do? What am I going to do? There was no answers. So I actually then decided I didn't want to do this thing, I wanted to do that. And it kind of evolved, and I'm just very fortunate in my mentors and my career where it's taking me. But one of the greatest things was meeting some physicians about 15 years ago who were going to dedicate their practice to veins. And
there you were.
There I was.
Because you know what it's like from the technical, medical side, and you also know what it's like from the patient side.
So when patients come in, I know how frightened they are. But I also know what an impact those doing the test can make. So I dedicate myself, and you too, to teaching others how can we help the patient the best. And it's been a great career, and you know, I've learned a lot, and I hope to continue learning. I mean, it's a lifetime learning.
And nowadays, people don't do venograms anymore, do we?
Correct. We use Duplex ultrasound.
We use ultrasound.